On Christmas Day, my 91-year-old mother came down with a bug. We don't know exactly what it was, but it was terrible is probably the kindest word I can say. She was brought to the emergency room and admitted here. My sister who lived with her had the same problem, and then my other two sisters came down with it. So eventually there were my mother and my sister here at the hospital at the same time. I asked if they could be put on the same floor to make it easier for us to visit, and they did. That was granted, and the care they got was just exceptional. Mother has had dementia, and the medications interfered with that a little bit. My kind, sweet mother became hostile and had to be put in restraints, and the compassion that they showed her was unbelievable. She would say things and do things, and they would just keep their calm demeanor and be as pleasant as they could, which made it easier for us. That's not an easy thing to do, to watch your mother when she's out of control. The doctors came in quickly and adjusted medicines and got that under control. She was eventually moved to the Geri Psych unit and then back to another floor. Had to have some surgeries, had to have x-rays, in a state of confusion, and everybody took their time and tried to explain to her what was going to happen and calm her during the process. We were really pleased with that. She did pass away at the end of January, and the nurses were very kind when they called to let us know that she had passed away. They came in the room and explained to us what had happened through the night and early that morning. And Dr. Vaughn, her attending physician, even came to the room to offer her condolences. That meant a lot. The thing that impresses me is that everybody in this hospital seems to be on the same page. Their focus is giving the best care to each patient.
Someone else about what RBC is all about, maybe they hadn't gotten trained yet.
Did a lot of research and really felt like relationship-based care really fit our Christian healing ministry here at Baptist, and we really wanted something that not only included nursing but all disciplines throughout the hospital so that we could give the best care to our patients in Mississippi. So really we felt like this was the model that Baptist would really not have any problem integrating, that it was already being done, and we just wanted to take it to that next step to get there. Relationship-based care basically took off in November of 2011, and what we've done that whole time is basically we've built an infrastructure. And how we've done that is first we made a committee called the Excellence Steering Committee, and what that is a leadership team that really has a multitude of different roles on that team, and what they do is they come together and they make sure that all the barriers that when we form councils on different units, that all the barriers are broken down for that. The second part of that infrastructure is forming unit practice councils on each and every unit. The unit practice councils basically are formed in waves. So waves are a 6-month period of time where we go in and we select different units and departments to go up with relationship-based care. And that's really a time where the staff have planning opportunities, they meet and discuss and work through a notebook that relationship-based care offers to really get to the core of what we want to do on that particular unit.
Relationship-based care is caring about the whole person, not just the medical needs, but about their spiritual needs also. And as caregivers, we can uplift their spirits daily by the things we do and say to them. So that's why it's important, and it's good to have the whole hospital involved in it so we're all on the same page, so to speak. And you involve the family and the person in their care. You don't no longer go to them and say, what I'm going to do for you today, but you say, we're going to do this today. You involve the patient. You don't just go in and tell them you're going to give them a bath, but would you like to have a bath today?
My role in the relationship-based program is I have the privilege to teach the Reigniting the Spirit workshop. It's a 3-day workshop that's held every other month as the employees go through the waves. The council chairs and the unit practice members are invited to the Reigniting the Spirit program. It's a time to take time out of their busy, complex schedules and really reconnect with what matters. Why do they come to work every single day? So some of the challenges are actually getting the employee to see that it is okay. It is okay to be selfish for 3 days. Your coworkers are busy. They're in their departments, helping their departments run and function. But we feel, the hospital feels, that this is very vital and necessary, and that we all need to stop and pay attention and to, again, refocus, for a lack of better words, why we come to work each day. There's 3 main areas of focus. The first day is we focus on care of self and care of the employees. And there is a statistic that says for every person that touches a patient, there's about 15 or 20 of us behind that person that's helping the person actually touch the patients. Teamwork is the #1 predictor of quality outcomes. Then that second day is we focus on our patients and our families. We actually bring some patients that have been a patient here in our building and their family members, and it's very exciting. We invite them in. We make it a very calm, inviting experience, and we want to hear the good as well as what were our opportunities. The third day is we talk about transformational leadership. We've sat for 2 days, 16 hours, and then it's not just to get out of work, it is how can we actually take these practices, this new knowledge, and walk it out? How can we put it into practice now? When it comes to leaders in healthcare and followers in faith, relationship-based care will directly enhance that. And the employees that are coming and getting educated, they are asking us, where has this program been? Why are we just now hearing about it? And it is just going to move us from good to great.
After the relationship-based care workshop, Reigniting the Spirit, it's more of a team environment where we had an essential core group that went and learned the concept and then came back and implemented different things that we had talked about and learned better to, instead of taking one core group to focus on changes, incorporating everybody into those changes. And so it became a team environment that way, because everybody helped to make the decisions, talk about the changes that need to be made, and we listened to people more. And one of the most important things that I learned in the workshop was that one of the facilitators said that their child told them to listen with their face. And so now I say that to my boss all the time, and to other people that I work with. Listen with your face, you know, I really need to tell you this. And so I intentionally try to listen to people with my face so that they know that I'm hearing them and that I truly understand. It helps me focus, and it lets them understand that I'm there listening too. And I think that's probably the most important thing that I've learned.
A couple of years ago, I read a book called Good to Great. It's about which companies have become great companies, not just good companies, and the methods that they went through to get there. The same things that are in that book I see at Baptist. One is to have a mission, a focus that everybody believes in. And 2 is to see that everybody thinks their job is just as important as somebody else's. That one person can't function well unless the other person is pulling their weight.